Hi, I'm Dr. Jeff Banas, and I'm going to talk a little about knee pain and what you could do about it. More importantly, what you could do about chronic knee pain or degenerated knee pain. A little personal experience here. Both of my knees are degenerated. I used to never have any problems with my left knee. I was training for a marathon one time, ran 8 miles one weekend, 10 miles next weekend, 15 miles, then suddenly my knee inflamed up. Gave me a lot of pain, so I went and got an MRI. When I talked to the radiologist, she just basically said, Jeff, you have a really old knee. The MRI report on my knee was actually 2 pages long, torn meniscus, multiple erosions in the cartilage. The only reason I'm actually telling you that is because I don't have knee pain anymore, and I do the Ironman triathlons, and I run the Ironman triathlons, a 112-mile bike, and a 26-mile marathon afterwards. I'm still able to do this stuff even though I have a degenerated knee. So I'm just saying that so you know that there are a lot of things that can be done. Okay? I'm constantly doing everything I can to keep myself active, and we can translate to our patients. And there's a lot of things that are overlooked when people are treating knee pain. The first problem when people are treating knee pain is they look just at the knee. Okay? And that's a big problem. You hate to say the straw that broke this camel's back, but there's a truth to that. Lots of times what happens, our bodies are doing the best they can under the circumstances, and then one day you run a little bit too far, you bend wrong, and snap, and a joint goes out, whether it's your back or your knee. So when we're dealing with the chronic pain, what we need to do is look at all the things that could possibly be wrong. So when someone comes in, or you're dealing with, if you're going to a doctor that's just looking at your knee and not looking at your back or your foot, in addition to the knee, you're probably missing some things that could be done to the knee. So when we look at a knee pain, the first thing that we need to do is start to address is your foot. A lot of foot problems could cause a knee problem. And why I say that is basically, you know, a picture says 1,000 words. So if you look at this picture right up in here, you can see how this foot is buckling in, and that knee's dropping, and that back's dropping. So if you're getting therapy on your knee, but then get off the table and you start walking around like this, well, no wonder you could have some type of knee issues. So we need to really address the foot. So when we want, if someone's dealing with knee pain, we first need to look at the foot, and we could look and see if your arches are dropping. Now you could just get seated, put both feet on the ground, and then stand up and see if your foots go from this to dropping in. If they do, you need a custom orthotic. Okay? And a custom orthotic is going to sit there and give that foot some support. We typically will put maybe a medial wedge, which means it might be a little bit thicker on the inside. And what that's going to do is stop that foot from rotating in. So if that foot, just like this picture, we will give some support on this foot, we'll keep this in line. And that's also how orthotic could actually help with back problems issue, or even up her neck, because this whole chain. You know, a foot problem could cause a knee problem, problem could cause a back problem could cause a shoulder problem, and so on. So you need to look at the big picture. So once we look at that, now we need to look at all the muscles around the knee, below the knee, above the knee. And we need to look for trigger points or adhesions. Trigger points are knots. Okay, so what you need to do then is some type of deep tissue therapy through the knee. Okay, and you can do that, try by yourself by something like some stick. So what you need to do is address the quadricep. This is, you could use the stick right here. You could use something called the foam roller, which is right here. And you could just Google foam roller or the stick and quadriceps, hamstring. Basically what you want to do is just free up all the muscles, the quadriceps, the hamstrings, the calf, the shin. Now ideally it would be beneficial to go see a sports massage therapist or a sports chiropractor or a physical therapist. Let them break that up. Okay? Because you could literally spend hours upon weeks stretching and make very little gains. What really needs to be addressed is deep tissue and breaking that type of stuff up. Okay, so we've got that orthotic in there, and now we've done deep tissue through the whole area. Now the next area we like to address is probably like a nutritional support, and I know a lot of people don't think about nutritional support when you're thinking about chronic knee pain. But I like a couple products. I like what's called a magnesium oil. And you get that at a health food store, and think of magnesium oil as a concentrated Epsom salt bath, okay? So what you do is you just rub the magnesium around the knee, around the calf, the quadricep, and you absorb that magnesium into the muscles, which a lot of times will help with some cramping. I also like taking a very high density amino acid. What I like the best is called master amino pattern, and you're just giving your body the proteins, the amino acids it needs to help repair. Okay, and you know, the thing is with chronic knee pain, what you need to do is we need to address every little thing that's wrong. Okay, that's why we can't just go, oh, knee pain, we need to do electric muscle stim into the knee right there. We could do that, but that will help with the inflammation in the knee. But if these other things are going on, the pain is coming right back. Then we do strengthening exercises to make sure that knee is in alignment. Okay, lots of times what happens is this knee cap right here, we're a little bit stronger on one side or tighter on one side, and we walk that knee doesn't glide the way it should. So you need some specific exercises for that knee. I'm not going to go through those right now. You could type in patellar tracking or knee pain and try to get some on your own, but ideally you're probably better off just taking the time and going to see the physical therapist, a sports chiropractor, get the exercises done right so you know what you could do, and then hopefully you could do them on yourself. And another area that's commonly not addressed is the low back, your hip or pelvis, or your sacroiliac joint. A lot of times people come in with a sacroiliac problem. Now they'll come in with a back problem and they'll feel that the little bump right in the back and they say this is where it hurts. And that's commonly called the sacroiliac problem. And what happens is your pelvis could kind of shift. Now some of the chiropractors talk about it shifted one way, physical therapists call it shift another way. Basically your pelvis could shift or lock up, and when that does, it could actually draw and make you have almost like a short leg. Okay, so that needs to be addressed, and that's typically done by a sports chiropractor or a physical therapist that's trained in manipulation, and get that back mobilized. So if you're dealing with like a chronic, like I said, knee pain, don't think right at the knee. There are types of things as far as different type of injections. Prolotherapy is a good thing if you got a lot of. You'd have to see a medical doctor or a DO trained in prolotherapy. Make sure they're specifically trained in that. You know, I like that technique. It kind of tightens everything up, but you still need to do all this other stuff. I actually had a couple prolotherapy injections done on my knee in addition to it. So when you're looking at like I said, a chronic knee problem like that, you basically need to start at the toes and go right up to back. Make sure everything in there is working the best that it can. So you're mobilizing the joints, you're mobilizing the ankle joint, you're mobilizing the knee joint, you're mobilizing the back joint. You're doing deep tissue massage through the back, hips, quads, hamstrings, all the way down. You're getting arch support for the foot to make sure you're not rotating in. Then you're getting strength exercises for the knee. There are other things as far as acupuncture and stuff that stimulate blood flow. So I know I'm throwing a lot of stuff out here, but I'm just trying to get, if you're Googling this, you're probably having some problems with your knee. And just wanted to let you know that these are a bunch of things that can be addressed. And when worked in combination together, they generally produce a lot better results. This is what I've done for myself. Like I said, I still run. I have to obviously modify my run. I don't go for 15-mile runs anymore. I don't run 3 days a week anymore. But I'm still able to do about 8 miles, 10 miles, and that's fine. And then I rest it up. I do electric stim and acupuncture and all this magnesium I use after every run. So just because you've been told you have a torn meniscus or degenerating knee, don't think your days of running or activity are over. So hopefully look into this stuff. If you got more questions about any of this stuff, go on my website, give me a call, drop me an email, and I'll try to help you out as best we can.